a copy of the file, you can have one. But we record just so we can, of course, later on, someone may decide they want to hear it. And that's that. So let me start off by let me talk about this month's Courageous Conversation. It really is about navigating the nuances between sadness, depression, and mental health. And I want to introduce rubybrownherring, who's the CEO of RBH Wellness Solutions. She assists businesses, government agencies, and nonprofits with creating employee well-being strategies that support mental health at work while improving belonging, engagement, and retention. Ruby has a Bachelor of Social Work and a Master of Education in Student Personnel Services. And she has over 20 years experience in program management, adult continuing and higher education. And she's recognized as a state and national leader in corporate wellness and community mental health education. So I just want to say thank you, Ruby. Welcome to the platform. Welcome to the Courageous Conversation, because I think this is a much needed conversation.
Absolutely.
Yeah. And when I started with you, before I get started, let me ask you, what prompted you to be in this kind of space?
Lived experience. That's what it boils down to. Lived experience with my daughter and my husband and myself. And so that's the thing that really springboarded me into this area.
It's always interesting that many of us have a lived experience that gets us started on whatever it is that really takes us to that next level, because it winds up it feels like that becomes our purpose. Whatever it is, we go through it so we know how to actually help other people navigate their way through it. As I shared with you, one of the reasons I wanted to discuss this is because last year, Stephen Twitch Boss committed suicide. And for those of you who don't know, he was a well-known entertainer. He was on Ellen DeGeneres' show. He was a dancer. He was a choreographer. He did a lot of things and was a very high-profile person. And in the midst of all of that, he committed suicide. And it threw me off because it just made me say, oh my goodness, what could have happened to him that would have made him think that was okay? Or that was the only option for him at that particular point in time. The other thing is, when you look at other people who've committed suicide, especially the well-known people, Robin Williams, Anthony Bourdain, Kate Moss, these people were at the top of their game as far as we know. But from what we see, they were at the top of their game and they committed suicide. So that became like the motivation for, in this space of talking about empowerment, let's look at what this is. So what do you say about that? Because I know I reached out to you when he committed suicide.
Yeah, no, Tanya. Here's the thing, and I'm gonna back it up just a little bit. And one of the things that I think is so important that folks that are listening to this conversation think about is, number one, language and how it impacts stigma around mental health challenges. Right? And so individuals that die by suicide, to your point, often feel like there is no other way out. They are sick. They live with depression or bipolar disorder, some other major mental illness that truly makes them believe in their brain that that is the best option for everybody in their lives. And when the piece around language is that, and this is not anyway directed at your use of the term committed suicide, but I think this is one of the areas that a lot of us in society, when we think about mental health challenges and stigma, a lot of this is, folks make choices, is what we often think about. Individuals die by suicide, just like they die by cancer. And so there's been a shift over the years from using the phrase committed suicide, because we commit crimes, we commit adultery, we commit sins. There's blame with that, right?
Okay.
And so by shifting the language to died by suicide, we're speaking truth into what really happened. Okay. That is the method by which they died. So I just want to point that piece out. But again, it's from the perspective of helping others listening to this conversation understand the difference and how even changing language can make an impact in somebody's life.
Right.
So back to Twitch and Kate Spade and Anthony Bourdain. Oftentimes when people think about folks that take their lives or have a mental health challenge, it's the assumption is folks who are struggling with other aspects of their life. They are struggling financially. They don't have people that love them. They don't have, quote unquote, everything going for them, as some of the celebrities that you mentioned we think they may have had looking out from the outside looking in.
Right.
But mental illness doesn't discriminate. Oftentimes in high profile individuals like Twitch, like Kate Spade, like Anthony Bourdain, the society's pressure of who they should be weighs on them, right? Yes. And so just because of who they are and their celebrity adds to that pressure of something that may be a genetic underlying condition that's already there.
Right.
So yeah.
Okay. I like that. I like that explanation because, truthfully, there's more than just high profile people who die by suicide. See, I'm gonna get this right.
And it's okay because language is hard to change. Yeah. So I definitely don't want you. It's okay if during this conversation you do say committed, because it's just who we are, right? And it takes, trust me, it has taken me 10 years to get to this point.
Okay. So. Well, I also have a very good friend whose daughter died by suicide. And so, even again, same kind of thing. On the surface, it looks like it's okay. One of the things I knew about her was that she dealt with a lot of anxiety. So she was very, very anxious about a lot of things. And, when I would talk to her, I was like, don't worry about that. You don't have to worry about this. All you need to focus on right now is this. Don't add this other stuff to it, really not understanding that there could have been something else going on, because in retrospect, I can tell you she was like that even when she was a little girl. She was always, even up through as she was growing up, she was always like, oh my goodness, I don't know about this. I'm telling you what, it's like, just calm down, just calm down. It's going to be all right, Yeah. So yeah, that's one of the things. So when we're talking about sadness and depression and mental health, how do you distinguish between the three? What are the differences there?
Right. Yeah, that's a really good question. We all have mental health, just like we all have physical health. And so think of mental health as an umbrella term for our overall mental well-being. The change becomes when we start to develop mental illnesses or mental health challenges, which are used interchangeably. So depression and anxiety are two types of mental illnesses that individuals live with, and they are two of the most common. And so I will preface this definition by saying, folks, I am not a clinician, I'm a mental health educator. And so the definition that I'm using for anxiety and depression really comes from the education perspective, not a clinical definition, but it's closely aligned because of the research that we've used. But anyway, it's that point. So when we look at depression is really, it impacts how we feel, how we think, and the way that we act. And so sometimes individuals might say, oh, you're sad. And I think this is one of the things we talked about.
Right.
All of us at some point in our lives have periods of sadness.
Right, exactly.
The difference between sadness and depression is sadness we oftentimes can navigate and still be able to move forward with our life, with our activities, and have satisfying relationships.
Right.
Depression, though, prevents us or negatively impacts our ability to have satisfying relationships with those individuals in our lives that we love. It impacts our ability to carry out daily activities, things as simple as we might think as getting out of bed and taking a shower. And it impacts our ability to go to work. So, and so what clinicians look at with anxiety and depression is how long does that happen? And what is the impact that it's had? So usually it's around a 4-week period that they look at. If it's impacting those areas, oftentimes when I'm doing this training called Mental Health First Aid, I'll use the phrase, if it impacts their ability to live, laugh, love, and learn for 4 weeks or longer, then that's when healthcare professionals will likely diagnose it as depression or anxiety or some mental health condition.
Okay.
Yeah. And I'll add the definition for anxiety. The example that you gave about your friend's daughter, anxiety does start young. Some of the most recent data has come out has said that individuals are starting to be diagnosed with depression as young as 6. It used to be 10, and now the data coming out is saying as young as 6. And so with anxiety, it's really looking at, again, it's that increased alertness, that increased fear. And you notice it in things like, increased heart rate, stomach problems. When we think about children, one of the things I always talk about when I'm talking with school staff is think about beginning of the school year, testing season, and end of the school year. When young people start saying, my stomach hurts, my head hurts, it's not necessarily they don't want to go to school, don't want to take the test. It could be some underlying anxiety there.
Right. Okay. That makes sense. That makes absolute sense. So let me add one more emotion in the mix, and you can talk about this too, and that's grief. Because you talked about how after 4 weeks, you're beginning to categorize it as depression, but with people who are dealing with grief, it's also another layer to me of what's going on, and that may be longer term. And so before you answer, I just want to say, hey, you guys, welcome to the call. Welcome to the conversation.
Welcome.
This is Ruby Brownherring, my guest, and she is a mental health and wellness. How you want to say it, Ruby?
Specialist is like you said, is what you have.
Okay.
That is fine. That summarizes who I am.
Okay, and what she's been talking about. What we've been talking about are the differences between sadness, depression, and mental illness, really. Mental health being the umbrella for that. And I'm just throwing in the mix. You talked about anxiety, and I'm throwing in the mix grief as well. Yeah. So you want to respond to that?
Yeah, no, I think grief is one of those things that we often experience that can impact underlying mental health conditions. So for example, some of us are at greater risk for developing anxiety, depression, or any other mental illness based upon genetic history. Right? Just like we have genetic history around diabetes, high blood pressure, cancer, there are mental health diagnoses that have that genetic link. So that said, an individual, let's say, if they are at greater risk for developing depression, if they are experiencing grief, that could increase the likelihood of that depression. Almost 12 years ago, my mother passed away. And as you know, we were very, very close. And so I experienced a period of time where after she passed, the grief of not feeling that I could mourn my mother appropriately in the moment, because I was taking care of my children and trying to support my siblings and my nieces, that grief impacted me later, and it caused my depression to really escalate. And there were periods of times where I literally could not get out of the bed because of the grief and the pain. Right. And so it definitely impacts it. And I think, as we look at folks, whether it's ourselves or those that we love that are experiencing grief, what we know, grief looks like this. There's no straight path, right?
I've been through it. Yes.
Right. And so even though grief may last longer than 4 weeks, what we need to look at is how is it impacting the ability to live, laugh, love, and learn. And if that is starting to be impacted at a level for an extended period of time, just encouraging folks to have conversations with their healthcare professionals. And because even having a conversation with the healthcare professional at that point, then they can determine, okay, this may be something that that you can navigate with additional support, whether it's counseling, or maybe you just need something like a grief share support group that puts you with people with similar experiences to talk through that.
Right.
Because many of us, and this goes back to the stigma around mental illness too, a lot of people think, oh, if they say that I have depression, or say I have anxiety or some other mental illness, I'm going to always need therapy. And that's not true.
Right.
And that's absolutely the case with grief. We may just need connection with people with lived experience,
Right.
similar experiences, to help us navigate and build those coping mechanisms.
Right, right. Because I can remember when I lost my daughter. And let me add this for you guys who are guests or who you're joined in. If you have questions for Ruby, put them in the chat. We'll get to all the questions before we're done. Okay, so just be sure. If you have any questions, just put it in the chat. We'll get to that. When I lost my daughter, there were days where I kept going because I feel like I didn't know what else to do. But I tell people it took everything I had to get out of bed every day. And there were times when people were like, oh, let's go do this. And I was like,
yeah,
I'm doing good just to be up. Don't ask me to go out in public and be around a lot of people because I don't know how I'm going to react and I don't know how I'm going to respond. And you may be trying to figure out why she's breaking down crying in the middle of all these people. But, I was truly grieving at that time and really didn't know what else to do. Other than that. Fortunately, like you said, I did go to a grief support group at the church that I was attending, and it helped me. But it was enough to help me kind of get through that period at that moment.
Yeah, no,
But
thank you for that, Tanya. And I just appreciate you being vulnerable, first and foremost, about your own loss, but also about the loss of your friend's daughter. Because here's the thing that made me think about. Your friends were coming from a good place. It's like, okay, if I can get her out of the house, it'll help her feel better.
Yes.
Right. And that's usually what happens is because we don't know. So if let's say, if you'd had surgery or if you'd broken your leg, they knew it's a clear-cut pathway to what that recovery is going to look like. With mental health challenges and with grief, there's no clear path. And that's scary for folks that love us. And so the intent is, okay, if I can just get them out of the house, get them doing things, they'll reconnect. But our brain doesn't work like that. And so it takes time. And I think you make a very good point, is not knowing how we're going to respond. Right. And so you as a mother who is grieving the loss of a child, not being sure how you're going to respond when you're seeing other families, right? And so you have this protective factor in place of, you know what, not just yet, because the fear of being judged, right?
Yes.
And I think the same thing goes with individuals living with mental health challenges. We tend to seclude ourselves because of the fear of being judged. Well, why aren't you feeling better? We got you out of the house. You should be happy. You still love these things. I do love these things, but because of what's happening in my brain in this moment, I can't find joy in those things that I once loved. And that's usually another sign for clinicians of something's going on. We should have a conversation about how we can navigate through some of these feelings.
Okay. So let me say, if anyone has questions, comments, put them in chat, because I will certainly have Ruby's going to answer all your questions, I guarantee.
I'm going to do my best.
Yes. Okay. So we're talking about these things. How would I know? Let's imagine that my experience, I'm talking about grief right now. We both talked about grief. You talked about losing your mom. And you know that I just lost father and stepfather like in November, which was like, it threw me off, really threw me off. And then and I lost my godson in August of last year. There was like a whole lot of stuff going on last year. But let's imagine that you didn't have a loss, but you're still feeling like, everything's not good. Life's just not good, blah, blah. And I'll tell you, I've had a friend who has shared with me, there's nothing to this life thing. I don't really, if from here, I'm not,
right.
And I'm listening and I'm just going, ooh, that seems a little serious.
Yeah.
Let's imagine it's not a specific thing that you can put your finger on. How do you know that you may be dealing with an experience that needs some support?
That is a really good question. And I'm going to reference mental health first aid a lot because it's a training that I think really breaks down mental health challenges for lay people in a way that it makes it easy for us to kind of process. And so one of the things that I tell folks, think about it in these 4 categories of thoughts, emotions, behaviors, and appearance, right? And so for you as a person, if I'm thinking about this for me and what's changed with me, how are my thoughts different? Right? Am I blaming myself for a lot of things more often than I usually do? Right? Am I having problems even concentrating on things? Am I worrying about a lot of aspects of my life? Again, I am a natural worrier as a person, but when I notice that my anxiety is increasing, I start to notice I worry a lot about things that even I can't control. And so that's the point where then I take a step back and start using some of my coping mechanisms, positive coping mechanisms. And so the same thing, so that's kind of like with depression. With anxiety, that's very similar. And so it may be the mind racing, your mind may be going blank. It may be, so irritability is one that we see often with depression and anxiety. And folks often think, oh my goodness, why? My mama's thing was, why are you so ill? Right. And it's that irritability, and it shows up with anxiety and depression. And so it's because our bodies aren't able, and our brains aren't able to kind of process what we're dealing with. Are you starting to, when we think about some of those behaviors around anxiety, are you starting to avoid situations? So the example that you gave with your friends after the loss of your daughter, if that started to happen more often, and it really came to the point where you were not leaving the house, you were not talking to your friends, those supports, then that for me is a flag. Maybe I should have a conversation with somebody, because this is not typical for who I am.
Right.
And so people just being aware of what's typical for you. My girls, I have twin girls. One of them, she's a homebody like her mama. She will sit in the house all day long, but she does enjoy going out occasionally and hanging out with friends. So if I were to see a shift in her where she's like, I'm not going out, I don't want to hang out with my friend Genesis, I don't want to go to work, then for me, that's a flag that something is going on. And I'm then going to have a conversation with her about, hey, I noticed you're not interested in hanging out with Genesis. She invited you to dinner, and I know you usually like that, but you didn't go. How are things going? And so it's not what's wrong with you. It's, I've noticed this change. So using those I statements are important, because what we do when we use I statements, we don't put blame on the person for the change that we've noticed.
Right. So this again is about language.
It is absolutely about language
again.
Yeah.
Yes. Okay. And so so this is like you experience this hit, whatever this situation is, right? And you have to learn how to work around it. Let's say it's I do have this situation. Maybe I don't have you in my life who's like, okay, so I'm noticing something. What's going on? What do I do? Because is anyone on here? Have you ever had an experience where you were just like, you thought you were depressed? You might have, in retrospect, you realized you were depressed, but you didn't really know how to address that at that time. If so, just kind of raise your hand so we know that you understand what we're saying here, because I think that's important, that you begin to understand what it looks like for yourself.
Absolutely.
I was going to ask you about healthcare professionals. How do you find a good healthcare professional, and really, what are you looking for? I mean, I guess, because, nowadays, and I see it, and I know it had a lot to do with what happened during the pandemic. Hey, raise hand, Eric, I see you. But there are people now who are offering therapy online, virtually. Made sense, especially during, a lot of people had to cope during that period. How do you actually find a good, effective person to talk to about whatever's going on? Because when it's virtual, you really just don't know. It's kind of like
that's a really good question. Here's the thing that I think, it's important for people to understand. If we were trying to find a primary care physician, even though, and let's say this is, say, pre-pandemic, and we sat in the office and we were like, I don't like your vibe, many of us would probably like, yep, nope, I'm going to somebody else.
Right.
Even if you are meeting a new mental health clinician in person for the first time, and we don't feel that vibe, many folks will probably still sit there, well, let me just try this out and see how it works. Virtually, you lose some of that, but I also, the thing I encourage folks to do with any healthcare professional, life challenges, interview them, have conversations with them about, okay, talk to me about, your experience in. And so usually what happens, that first session that we have, it's like, I should feel better after that first session. No, because you didn't get to this point overnight, right? And so it's going to take some time for them to develop that relationship. They've got to get some understanding in terms of what your history is, what brought you to that space.
Right.
And I think oftentimes that's what the unrealistic expectation that many of us have is, well, you're the therapist, you should be able to fix it. It didn't take one day for you to get here. So a therapist is not going to be able to, quote unquote, fix it, even though I don't like that phrase, in one day. And so giving yourself time to develop that relationship with that professional. But if you in your gut don't feel that they are hearing you for what you're experiencing, they're not connecting with you. One of the things that we hear a lot these days is the importance of culturally competent professionals, whether it's mental health or physical health. And so it's okay for you to say to a white female therapist, you know what, I'm vibing with you, but you're not understanding me as a Black woman. Do you have a Black woman that you can connect me to? It's important that we advocate for ourselves. And it's not saying they're not good at what they do, it's just saying they're not good for me.
Right.
And so taking the time to do the research on the professional, a lot of them have web pages now where you can get a lot of information about them. Look at reviews. I recently, probably about 6 months ago, signed up for therapy using the BetterHelp app. And I know a lot of people have had experiences with that, but one of the things that I was very particular about is I wanted a Black woman and I wanted somebody from the South, right? And so after mulling through several folks, the first two people they matched me up after I looked at their profiles, like, no, I'm not feeling the information, because all I have to go by is what they have online. And so if I'm not connecting with what the words that they have online about themselves, then no, because I don't want to risk having to tell my story and it not be honored in that space.
Right.
And so we have to do the work. We have to do the work and interview them literally before we sit down, because what we risk doing is re-traumatizing ourselves.
Yeah. And I could speak to that too. I went to a therapist for a number of years and it was interesting. I didn't know, and I felt like, but I didn't know if it was because it was my first time ever going to a therapist or if there really wasn't a disconnect between us. And she was a Black woman. And I really felt like I should be getting this. I just don't understand. And I mean, I felt like I really had to be protective of myself in that space, which meant that I didn't get as much out of it as I could have. And I'll tell you why, because I met another woman through the women's ministry at our church, and she was just, she was one of the speakers, but I was like, oh, I love you. I talked to her and I told her about the experience, and she says, some of the she said the way we're taught, it's like you have to just be like a blank wall, which means that you don't get the kind of feedback that you need. She said, so it just may be the way her training. She's gone beyond that, and that may be what you experience, because this other, her name is Celeste, and she and I feel like she was my friend. I'm like, hey, Celeste, so we vibe that way. And I appreciated that, because she made things, I felt better about therapy because of her.
Yeah. Yeah.
And because I knew that there were people out there who had that kind of spirit in what they were doing. And I was really grateful for that. So
You said something really important there that I think, I want to highlight. You felt better about therapy because of her. And that's the thing. Research shows that if we feel connected to our therapist, our mental health professional, even our healthcare professional, we're more likely to stay on the path to treatment, as opposed to going through the motions. Well, I'm just going to show up and I'm really not getting anything out of it. And so that again, it's so important. And I think sometimes, and I'm speaking this from a Black woman's perspective, I know when we think about culture and we think about the distrust in healthcare systems, particularly in the Black community, if that connection is so important. And it's okay for us to say, I appreciate your experience and who you are, but you're not for me.
Right.
Because we owe it to ourselves to get that healing. I saw Georgia with a hand up.
Georgia, do you, I'm going to unmute you. I'm going to ask you to unmute yourself. So Georgia, you have a question?
Yeah. So I wanted to add to that because I think as a mental health instructor to myself, and a part of it is one, becoming normalized with our conversations as far as asking for reference around mental health, being able to speak about it, right? We would ask for references for doctors. We would ask for references for other things, right? And so a part of normalizing and being able to kind of find that connection early on is really asking our community, those that we know, our providers, right? Because if we are frequent with our providers, primarily our PCP or a primary care physician, right? We would ask, do you know of? And they know your style, and you can kind of dictate what you're looking for on the, on the forefront to help to define what that individual could look like for you. And just one of the things that I hear that Ruby mentioned is the connection, and just we find connections in other areas, but for some reason around mental health, because it's not widely talked about, especially within our Black culture or, the minority population culture that it's really highly impacted with, we tend not to be open about that, right? And so one of the ways that I would recommend, even when, I get, I teach and I train and folks say to me, hey, I really need to find someone. I took your class for myself, but I really need to find appropriate professional help. And one of the reasons are, who do you know in your community that may have, that you may know that you can speak with, right? Because that's where we're going to help to kind of get to find out who the provider is and ask questions up front. You don't have to make an appointment with a provider and go in just not knowing anything. I want to have a few minutes with you, even if it's 5 minutes. It's a relationship. And one last thing I will say, don't wait until you actually need a therapist, right? It should be a part of your wellness team. For myself, my therapist is a part of my wellness team. I don't necessarily need that individual often. I use her, or even if I'm making a decision that may impact me in other areas, right? It may heighten my anxiety, may, bring across things that may affect my personal life, my family life. I want to create a culture, or I want to promote a culture that we use therapists as a part of our wellness team, right? Not just when we need it. And that way we know that there's someone there should these things come about that we really need to, access them. But I would say don't wait to find one, because often at that time, there's so much going on that you really can't really sometimes articulate what that person is going to look like, what that team member who's a part of your wellness team should look like at that point. So that's my few words there.
That's good. That's helpful. I thought that was really, really interesting. I think that's interesting because if you can do it while you're feeling calm and you don't have you're not in crisis at that moment.
Absolutely.
Your decision making different.
We should be preventative. I believe wholeheartedly in prevention. And one of the things that I often tell my clients and anybody that reaches out to me, it's like, okay, you always have a dentist on hand. You may only see them every 6 months. Have a therapist on hand, because we just need somebody to. Having a therapist doesn't mean that you have a mental health challenge. It means that you need somebody that's not connected to your family and friend circle to help you process life.
Objective voice.
That's it. You know what I'm saying? And so I'm so glad Georgia mentioned it, because it is so true. And I think, again, it goes back to the stigma of, oh, the only people that have therapists are people who have a mental health challenge, or using stigmatizing language that we often hear in society, people that are crazy, right? And so think about prevention and how do you stay well? And so I'm trying to prevent those cavities, because I'm going to my dentist every 6 months. We should also try to be preventative in our mental well-being. Yeah, really good point.
Yeah. And honestly, the reason I went is Audrey Chapman. I was living in DC. Audrey Chapman was on the radio every Saturday, and she would always talk about it. And she's a mental health person. She was a psychologist, I think she was. She always talked about, you probably need a therapist. If you're going through this, you probably need a therapist, just to talk about it, which is what made it kind of, it opened my eyes that, I might need to talk to a therapist, because I found myself repeating a situation over and over and over again. Well, let me go and find out something about this.
Yeah.
So let me ask you about recovery.
Okay.
So when you're talking about, you're dealing with either sadness, depression, anxiety, grief, and or some other kind of mental illness, what does recovery and hope, what could that look like?
That's a really good question. Hope is really helping people understand that while it may be challenging, it may be bad in this moment, it's not necessarily going to always be like that, because we have supports in place, whether it's therapy, whether it's friend groups, whether it's community organizations that we're involved with, right? Our village that help us navigate those challenges in life. And when we think about recovery, it looks so different from person to person. Just like with grief, recovery looks like this. And oftentimes when we think about mental health challenges, particularly substance use challenges, the definition of recovery that many of us in society have is, oh, well, then you shouldn't be drinking or using drugs. That's the only way you're going to find recovery, is to be completely clean. And that's not true. Recovery for an individual that, let's say, has an alcohol use disorder, it may mean at the beginning that recovery for them is, instead of drinking a fifth of liquor over the course of a weekend, they're only drinking a pint. It's a reduction in usage. That's recovery for them, because it's an ongoing journey. They're not going to be able to go from a fifth on the weekend to no alcohol on the weekend. Think about folks that have tried to give up coffee.
Or cigarettes.
Or cigarettes, right? My mama was a smoker. And oftentimes I remember thinking, even back then, well, just stop smoking. It's not that easy, because I gave up sodas 5 years ago. And it was the hardest 2 weeks of my life as I went through those withdrawals. And it made me realize, oh my goodness. And so recovery varies from person to person. And oftentimes what happens is, because individuals supporting a person going into recovery, we don't understand that it looks like this. It's, well, you should go from having symptoms to no symptoms. And recovery simply means, in many cases, a reduction of symptoms. And then hopefully they can move to no symptoms. And the thing about it is, it's equally as important for individuals on the road to recovery to have support during recovery as they do in the height of their illness, because that's when crap gets hard. Yeah. Right. And as we think about supporting folks, and even supporting ourselves, and not having the blame of, oh my goodness, I can't believe that I just had 2 glasses of wine. I shouldn't be drinking at all. 2 glasses is better than a bottle of wine. And so giving our own selves grace in that moment, and understand it's going to be constantly changing. There's this mental health model that's called Stages of Change that really helped me understand recovery many years ago. And it truly helped me understand it when I was trying to go through this weight loss journey of my own. And I wish I could remember the 4 stages, but one of them that comes to mind, you have that pre-contemplative stage of where you recognize, yes, something is wrong and I need to make a change. And so we think about it, and that thinking about it may be having conversations with our loved ones or a healthcare professional and trying to decide, yes, am I going to make this change? And then we move into the next stage, again, that I can't remember, and I'll send you a link to it, where we're starting to make this change. And for me, with my weight loss journey, it was, okay, I'm giving up my Pepsis and my sweet tea. And then it was like, oh, I'm going through withdrawal. I don't like this feeling. I could have easily dropped out of that stage of change and gone back to drinking. But I was like, I'm going to try this out. And then we move through that process. Often what happens in recovery as we move through those stages of change, life happens. So let's say I lose a job or I get a boss that is challenging for me at work.
Mm-hmm.
And to navigate or to manage that situation, I go back to that old behavior. Right. And so I start over again. And oftentimes when we have those relapses, our cells are like, oh my goodness, I can't believe it. I'm always going to be this way. Or if the folks that we love say, see, I knew you were not going to give it up. But we still have that option. We have those supports in place. If we have people around us that say, you know what, this is hard, you can do this. We have professionals that can say, this is hard, you can do this. We can start back over and go through that process again until we're able to move into full recovery, where we have, in some cases, absolutely no symptoms anymore, or the negative behaviors are completely have gone away. Yeah. But recovery is hard, and it's not a straight line. And I think with mental health and substance, especially substance use, because in society the stigma is you make that choice to take that drink or to use that drug. And you can't. It's a brain disorder.
Right. And I as you're talking, I'm remembering I had a friend whose name was Quincy, who was diagnosed as an alcoholic. And I remember his frustration because he says, even if I give it all up now, if I drink one more time, 10, 20 years from now, I'm like back in the same spiral. And I honestly didn't know what to say to him because I didn't have the space to handle that. I didn't know what to tell him. Mm-hmm. But I know that the frustration that he had about the fact that, he could give all this stuff up and then in 10 years he can take a drink and he might find himself back in the whole thing.
Absolutely.
So, yeah. One thing that you and I had talked about briefly were celebrities who were dealing with, living with mental health or mental illness and how they coped. What kind of coping behaviors do you think people might have?
Yeah. Oh, that's a really good question. Yeah. I just want folks to I want to mention some of those folks as we talk about some of these coping mechanisms that they might have. So, some of the most common celebrities that live with mental health challenges have spoken about it and have systems, have supports in place to be able to navigate that and be in recovery. Mm-hmm. Beyonce is one. And with anxiety.
Hang on, stop for a second because you froze. You froze for a moment.
Oh,
so
froze.
You said Beyonce is one.
Beyonce is one. We also have, for folks that like to watch General Hospital, and love somebody on that show named Sonny Corinthos. Maurice Bernard is his name in real life. He lives with bipolar disorder. Right. There's so many other individuals that have talked about, Dwayne "The Rock" Johnson has talked about it. Wayne Brady has talked about it. Mm-hmm. And so, the things that folks can do, first and foremost, therapy does help them develop those coping mechanisms. One of the things that I do and one of my girls uses when we experience periods of where our anxiety is high, take a moment and taking a deep breath. Literally breathing in through your nose, out through your mouth. Yeah. Because what that does, it helps reset your parasympathetic nervous system. Sometimes folks practice mindfulness where they really pay attention to how their body is feeling in that moment. Mm-hmm. And just being aware and present in that moment. Some individuals may use medication, and I know everybody has their own opinions about medication, but here's the thing that I know for a fact. Sometimes it takes therapy, and medication for just a small period of time, or maybe a long period of time. And so being open to that. Other things could be, just being connected in your community, whether it's volunteering, where you're feeling like you're giving back to the community, whether it's being part of a small group at church. So thinking about those social connections that help you feel good about yourself and feel like you're contributing, but also satisfying relationships with folks. Just having good people in your life that, number one, make you feel good about yourself, but not to the point of where it's always, oh yeah, you're good. But you need those folks in your life to have those hard conversations. Like, wait a minute, something's not right. And I hear you saying you're okay, but I want you to know it's okay not to be okay. And I'm here to support you. Right. So those are just a few of the things. And that's the thing, that's the beauty about therapy, is that a therapist can help you develop those coping mechanisms that work for you. If you're a person that is struggling with time management, and that causes your anxiety to increase, then having somebody that can help you come up with some techniques to manage time or to prioritize things. And so, yeah, those are just a few of the things that I think. Eating good, eating well, I guess you say, getting sleep. There's so much research there between sleep and mental health. Go ahead.
I was going to say, that's how I know when I have a lot of anxiety, is because I can't sleep. And I'll go to sleep because my body is just like tired,
but you can't stay asleep.
So
right.
That's for me is always a sign that there's a lot going on.
Yeah.
You just can't calm it down.
Right.
So
absolutely. Yeah. So paying attention to your body, just like we would pay attention to our bodies. If, I notice, I'm having a lot of headaches, and I know I have a history of hypertension in my family. You're paying attention to that. We should pay attention to what our body, because our body tells us when something is not right. And oftentimes we ignore it. And so even if it's, let's say if somebody doesn't want to go to a therapist because of the stigma, then go to your primary care physician, because they can then rule out if it's a physical health condition or if it's something that you may need to have a conversation with a therapist about. And usually if it's your primary care physician or your general practitioner making that suggestion, folks are even more likely to go ahead and reach out to that therapist too.
Good. So how do you support someone else who's going through?
Oh my goodness. There's this thing, there's this phrase that a colleague of mine used several years ago when we were training together that has stuck with me. And it's called the ministry of presence. Oftentimes when we have somebody in our lives that we notice are having challenges, because we love them and we want them to be better, we go into, I got to fix it mode, right? But that may mean we are experiencing periods of silence where we're not saying anything. And that's hard for us, because it's like, I'm their friend. They came to me. And here's the thing, it ain't about you. It's about that individual. And so sitting and being present with them, asking them how we can support them. Because if we ask them, then they're telling us what works for them, as opposed to us trying to guess at what we think is best for them.
Right.
So listening to them, the training that George and I do is called Mental Health First Aid, as I mentioned. There's a piece in the action plan that says just listen non-judgmentally. And again, as a society, it's often hard for us to listen to folks without allowing our own beliefs and judgment to come into play. But it's critical, because in that moment, even in the slightest of, well, get over it, or things are going to be better, you're saying to that person that what you're experiencing isn't valid and it should be easy to navigate. And so that's dismissing what they're feeling. And in that moment, they're like, okay, you don't care about me. You're saying you do, but you don't. And so just finding ways to be present with the person, ask them, and put our own biases and beliefs aside, and just support them where they are.
Okay. Okay. So let me ask you one more thing, because there are people on here who are doing big things or moving towards that space where they're about to step into some different things and they may be big. And so when you're looking at fame, success, and anxiety, how do they tie together and how do you avoid self-sabotaging under those circumstances?
It's the unrealistic expectations that society places on us, right? And so if we're doing great things, we have this perception that society wants us to look like this or do this.
Mm-hmm.
And then we're second guessing ourselves. Well, maybe I'm not good enough. And so I am not. So then I'm comparing myself to what I feel I am to what society believes I am. And that's where kind of like the challenges come into play, because then it's okay, maybe I'm not good at this. Maybe I shouldn't be the person doing this. Maybe I don't deserve to be here. And so what I say to folks, and I tell myself this often, is you earned the spot and the place that you're in. Is it going to be easy? No, because life isn't. But here's the difference. Taking that moment to pause, finding somebody that can help you talk through what you're feeling, or even if you don't want to talk to anybody, get you a journal and write it out. Because once you get those thoughts out of your head and onto paper or attached to a therapist or a coach, a life coach, it helps you then start to put the pieces of the puzzle together and understand that the things that you're believing in your mind are not the truth. Right? And then you can put together a plan of, okay, how can I then navigate through this? And again, it's hard. It's hard when we find, and society's kind of defines success as, oh, you're this wonderful person and you're making these hundreds of thousands and millions of dollars. Success in my mind means my lights are on and everybody in my house is alive. Right?
You have to define that for yourself.
You have to define it for yourself. And it's hard not to compare ourselves to others. So even in, the work that we do, I would love to be able to do something like this Courageous Conversations. But here's the thing, I don't have the bandwidth. Right? And so it doesn't mean that my work as a wellness professional isn't good. It just means having an online platform isn't part of my ministry, and be okay with that.
Right. Okay.
So we pair up with people like Tanya and Courageous Conversations. Yeah. You got the platform, I've got the subject matter expertise.
Information, right.
Work together.
Exactly. And so Melinda made a comment that this is a great question because this has been hitting her lately. And so Melinda, you want to come off mute and ask a question or make a comment about it?
Well, just that doors are opening, and so well, just pretty much how the way she answered it was perfect, because doors are opening at the same time. Stuff is happening on the left side and chatter is taking place. And one thing, never want to step outside of the wheel, never want to get off track of the purpose. And so in the meantime, this chatter over here is still taking place. So yeah, I really appreciate that question and answer.
Yeah. Okay. One of the things I will say to you, Melinda, is jot down all the things that are happening, right? And really, as you talk about not stepping out of the wheel and the purpose, because there are going to be doors that open. And that's one of the things I've learned being a full-time entrepreneur for the last 2 years. Doors will start opening. I think I got to go through them all. And I had to pull back and be like, okay, I remember something my mama said to me years ago, all money ain't good money.
Right.
And so jot down all of those doors, those opportunities, and pick the ones that align with who you are and within your purpose. Because if anything takes you outside of your purpose, that's going to impact your well-being, because yeah, I'm doing this, but this is not aligned with who I am. And it will start to weigh on you and pull you away from what you are meant to do.
Thank you.
You're welcome.
Okay. Does anyone else have any questions? Robin, you haven't made a comment yet. Georgia, I know you made a comment. Eric, I'm not sure if Eric is still on here.
I think Eric left us.
Eric might have left us. Okay, all right. Anyone have any other questions for Ruby? Because Ruby, let me say this. This has been good. This has been a great conversation. I enjoyed it because it also, not just because of the suicide, and I know that's where how I present to you, but I think that as people are navigating through life, the truth is life happens. Life is lifing. We're going to run into something that's going to cause us to sit back for a minute and think through what do we do? How do we manage what's going on at this moment? It's just the way life is. We have to figure out how to navigate our way through life. And what's helpful is thinking about the different options that are available to us in order to navigate our way through it. Yeah. And so I just want to say thank you, because that's important. I think that we just know what to do, because it does put us in a position where we are in control of our own health. And I like what you and even Georgia mentioned, that you have to have a healthcare professional as part of your whole healthcare plan. Yeah. It's a whole thing. It's a holistic kind of perspective.
It is. Our brain controls the rest of our body. So if our brain is not well, the rest of our body is not well. And I think, the final thing I'll say is you just said something, Tanya, that I think where a lot of people are right now. The death of Twitch, just like the pandemic, caused a lot of people to pause and be like, oh my goodness, what just happened? And we're reevaluating life. And so that's often what happens. Is it usually takes a crisis. It takes the George Floyd murder, right? To cause people to pause and think about, I don't like what's happening in my life, and it's time for me to make some changes. And so by having that healthcare team that has a mental health professional in it, or having some of these other systems in place, it prevents us from being reactive, and we start to be proactive. And that's how we're able to navigate our lives and be fully in a place where we have well-being in all of those 8 dimensions that impact our overall health.
Overall health, right. Okay, so good. So thank you. So what do you have going on in your world and your community?
Oh, wow. So much is happening. A lot of the work that I'm doing right now is around teacher well-being and school staff well-being. I'm working on a state initiative here in North Carolina with our Department of Public Instruction, because across the country, we're seeing teachers leaving the workforce. And so doing some work to address that.
And nurses.
And nurses, right? So I'm doing a lot of work addressing that and addressing youth mental health. And so just signed a 2-year contract with the state of North Carolina to build out a statewide initiative to help address youth mental health in the schools, to provide some trainings and put some programs in place to help address that issue, as we've seen coming out of the pandemic with the Surgeon General's report that we have another epidemic around us with child mental health and youth suicide. So still doing a lot of work around prevention, and really within organizations, creating that culture that supports mental health and helping organizations know there are a lot of people living with mental health challenges that do dang good work. So how can we support them and keep them employed, as opposed to them feeling not supported and leaving the workplace and it costing organizations millions of dollars each year? Okay,
awesome. Well, thank you, Ruby.
Thank you.
I appreciate it. And everyone, thank you for joining this conversation. And I hope you've gotten some good information from it. With that being said, take care.
Take care.
Bye for now.
Bye.